I just.
Right. Welcome everyone to the April 25th April meeting of the MedXR Advisory Council for XRSI. This session, we're going to introduce Paul Jones, a new member of the council, and support of XRSI for years, actually, and have that introduction, and then we're going to just go over the progress and updates, including our plans for AWE. That's pretty much the whole agenda here, the AWE, and then the clinician's guide that we're making steady progress on. All right. Okay, so now who we have with us today, we have Paul Jones, Ryan Cameron, and Joe Morgan. Ryan and Joe, if you could give a quick hello to Paul.
Hi, Paul. Hey, Paul. Ryan Cameron. I just am a XR enthusiast, and I work primarily as we are here in the medical space. I got an interesting patent recently with the U.S. Patent Office to kind of establish a series of tools and best practices around how to interact with patients or have a clinician interact with a patient while they're in VR and collect data. And I've been working for the last year or so as well on a NIST-funded grant to look at how to collect data and then use machine learning to authenticate users who are first responders in a kind of a on-site situation or scenario, like police or ambulance drivers wearing or using AR. That's me.
Cool. All right, Joe, may you give a quick intro?
Yeah. Paul and I know each other, but
okay,
I'm Joe Morgan, and yeah, nice to meet you.
And I see Jared's here. Thanks for joining, Jared. Can you give a quick intro before our speaker, Paul Jones, begins?
Sure. Hi, I'm Jared Cutson. I am a senior director at the Icahn School of Medicine at Mount Sinai in the simulation program, and a faculty member in the Department of Emergency Medicine and Medical Education. And I am president-elect for the Society for Simulation in Healthcare, the Global Simulation Society.
Well, okay, cool. Nice to meet you.
Sorry, we can hand over the screen to Paul from Immerse, and he's going to share more about what he's doing there and where this intersects with our mission at XRSI. Thank you, Paul. It's all yours.
Hopefully, is that showing the main screen or is that showing my secondary screen?
Your main screen.
Presentation screen.
Main screen? Yeah, okay, cool. Well, thank you for having me. I wasn't 100% sure what to put on some of these slides. I had some wonderful little prompts, but I've chucked a few things up there that you can see about me. I live in a very small little village, so hopefully my connection here will be okay during this presentation. Unfortunately, I've got to drop at the half hour, so I'm probably going to talk relatively quickly, but there's not a whole host of people on the call. But if you have any questions, then by all means shout and ask. I am sorry, I have an 8-year-old. No, Bubba, I'll speak in a bit, okay? Love you. Sorry.
Not an 8-year-old.
9-year-old. Sorry, I'm doing him a disservice. 9-year-old.
I have an 8-year-old, so
he's desperate for his Switch. I think that's what it is. So I've spent the last 16 years at AstraZeneca, where I was the head of emerging technologies, as it says on the slide. And I led the creation and setup of their internal XR capability. So soup to nuts, from the vision for it to implementing and defining the services and the technologies that we were going to stand up internally to do everything from collaboration use cases through to bespoke content and kind of even off the shelf stuff, from content creation through to data analytics and the strategy for that piece. Some fun things about me there. It kind of says I've done a whole bunch of different things and held lots of different random jobs actually. Probably the one that I enjoyed the most was being a painter and decorator because you didn't have to speak to anyone. And sometimes us guys like being in our caves and not speaking to people. But as it says there, my favorite quote is Albert Einstein in that I have no special talent, but I just love everything technology and emerging technology and future and vision and strategy and seeing the synergies between things and spotting the opportunities of how these things converge in terms of different technologies and the future. As it says at the top there, I'm in the working group for the spatial web, etc., and regularly join their meetings, and very much looking at the future of technology in that sense. This will click forward. So this is the kind of a bit about you and your work slide. So I left AstraZeneca 4 months ago and sort of took a bit of a leap of faith. I think it's popularly referred to as ikigai now, right? It's the buzzword that everyone's going on about and sort of doing something that's a little bit of your passion as much as it is a career change, basically. And so I joined Immerse.io, who are a virtual reality platform company. And they're very, very different and very, very uniquely placed in that it's actually the data that the platform serves. Yes, it distributes the content, but it's very much around the platform and the data. And part of the reason I did that is a few years ago, 5 or 6 years ago now, I was thrown the type 1 diabetes boomerang. And there's a lot of people you'll speak to who work in life sciences and pharma companies who talk about being patient centric and thinking about the patients and all that kind of stuff. And lots of you guys work directly with patients, right? So you probably chuckle a little bit when those guys say that. But I guess when you get like hit with something yourself, which is life changing, and is the game of high speed chess that you're constantly living, as I call it. When you've got something like type 1, you really, really kind of start to comprehend and think a lot more deeply around patients and what's happening with their data and those type of factors, basically. And so I was doing the why piece of having architect problems out of existence, which is kind of a mantra I try to live by when looking at emerging technology. Is not just, hey, we need this piece of technology because it's going to scratch this itch. It's actually, how can you utilize it to totally eradicate a problem? And you might argue that, the iPhone solved the problem of carrying a camera and a map and a laptop computer and all of these things, right? It's kind of how do you solve for something by removing lots of different things, right? And right now we're obsessed by electric cars, right? Why aren't we obsessed by electric airplanes, helicopters, and whatever else? Because ultimately, if we've got electric cars, we're still tearing down trees and ripping up the earth to put more concrete down so we can drive electric cars, which are supposedly more than economical and sustainable than petrol cars, but yet we spend 1.5 trillion tearing up the planet to do that. It's not sort of architecting the problem out of existence, really. So when I was looking at the ecosystem within AstraZeneca for XR that we were creating, was very much predicated upon the fact that I'd worked historically in the commercial part of the business, for example, in operations and across multiple facets, and seen how those parts of organizations, when they start to go after a piece of technology or a different space, when they started to go into mobile and iPad apps, for example, right? They had and websites, they had a million different agencies all creating content for them and all providing them analytics in multiple different formats, which they couldn't use and consume and pull together, etc. And it was pretty obvious that this was going to happen with XR. And so when we were designing the ecosystem, we were very much looking at the architecture and saying, well, how can we make that problem go away? And very, quickly we came to the realization that we needed something that was going to allow us to capture all of the data in one place, almost like your SEO, your Google Analytics, right? But for XR. And we did some scouting around, and we settled upon Immerse because it just seemed to be the only platform out there that we could find that was agnostic. And that was the really, really key factor in this. We still needed to make sure that we were enabling the multiple facets of the organization to do what they wanted with who they wanted in terms of creation, because the people they would be speaking to were going to be the experts in their field, right? It's much like some of these companies might speak to yourselves. You're the experts in your field in terms of creating the content for that use case, etc. But in terms of the analytics and the data from an enterprise perspective, wanting to get that back to one place, that was what we were trying to solve for, and that was the bit we were trying to architect out of existence in terms of a problem. And so that's great when you're looking at sort of what I call B2E, so business to employee use cases, training, soft skills, human skills, and all of those kind of sort of internal type use cases. And the beauty of it is right now in those use cases, clearly, the privacy entities within organizations have solutions for that. There's policies, they can mitigate those pieces, etc. But the so what is what happens when, actually this starts to focus in on the patient, right? All of these life science companies and the agencies who serve them, put patients in the crosshairs, right? As we think about things right now, the challenge is that, most of what we're doing at XRSI, etc., is talking about, what are meta capturing from a headset perspective, from a device perspective? What are these companies able to do? But actually, there is a far more unique perspective here, and it's not just the devices, it's actually the content themselves, and it's not even the platforms. It's literally this fragmentation within the ecosystem when it comes to content. And many of you guys will know lots of pharma companies are experimenting in this space. You guys are experimenting in this space and researching, etc. Every day we're seeing announcements, more and more partnerships and different solutions going into the hands of patients. But the data is the last thing that people are really thinking about, unless it's for the purposes of proving the ROI of the unique piece of content they've created. They're not really, people aren't really collectively thinking about beyond that piece of content. What does it actually mean as an ecosystem? What does it mean as an enterprise? What does it mean from a societal perspective? And that's one of the key things that I think we really need to kind of focus on. The question that sort of sits behind this slide when you're putting them together is, how does this unique question or proposition or challenge or issue impact the council's working and strengthen its efforts? And right now, I think what we're doing is, it could be perceived that for all of our talks and the standards that we're creating, we're not actually really collectively drinking our own champagne, right? We're not pulling together the force of all of the different diversity of skills and knowledge and experience across everything that we're doing and saying, hey, you know what is that sort of patient data-centric vision at scale, which actually accounts for this? It's really interesting. Cameron saying he's got a bunch of patents here, etc., for for what on the surface seems like, potentially a bunch of unique use cases. How does that scale? How does that become really, really, truly, truly scalable? And I think that's where we both have a challenge, but equally, what the blessing is, we've got some fantastic people here, that we can pull together and truly create a vision for society. I think that's where we can really do, data centricity at scale and start to help, healthcare organizations across these different countries start to get ahead of the curve in terms of their thinking. How are they going to serve up these solutions to patients? How are, we gonna mitigate for the cross section of pharma and what they want to deliver in terms of content and digital therapies, etc. Researchers, academia, all of these startup companies who are uniquely placed to create fantastic content, right? We've got Joe on the call, right? How are we, uniquely placed to bring together everything that XRSI does, and not just through standards and the stuff that we're doing. How are we actually able to sort of, deliver a vision for that? is the opportunity of how we can really strengthen what the council are doing and our efforts in this space, and architect the problem out of existence. And that is my little introduction to me and a little bit of what I'm now starting to try and do. I am the VP technology strategist for life sciences at Immerse. That means I have to kind of do, I guess, what is slightly cliche, and that is, I guess, some business development for the platform in life sciences. That's just the reality of the situation. But I'm very, very strategically keen to talk about the future beyond just the platform and how things should be delivered in a far more cohesive manner. Address for Immerse, and the website is there on the page. My LinkedIn profile is there if you want to connect. And if you have any questions, feel free to come from mute and ask away. But hopefully that's a good little introduction to me and what I'm doing, and hopefully some of the stuff that I can bring to the wider group.
Thank you, Paul. It's a fabulous introduction. And it's wonderful to hear your perspective at that high level and the motivations, since that translates into, what really gets done, where the priorities are set. Jared, Ryan, do you have any questions? Sorry, I'm just seeing the J. It could be Joe. No, it's Jared. Do you have any questions for Paul?
Are you actually making technology, or are you looking to coordinate companies that make technology or liaison with them or something?
Great question. So Immerse themselves, we actually have a platform and an SDK basically, which means anyone can create the content. It's totally agnostic. So you can create the content, plug in the SDK, whoever it is that you're serving it up to. So it could be an FDA, US government, a hospital entity, etc. They then receive the analytics, the data, etc., back to their version of the platform. So it's totally agnostic. We can create the content, the SDK goes back to the entity, or they can create it themselves. That's the beauty of the platform here. Ryan, is literally, it's agnostic. It doesn't matter who creates the content. It can be, simple stuff, WebGL, or it can be full on immersive VR, etc., etc. And it doesn't matter which device either. So it's agnostic to the device. So, you can consume the content on a laptop even. If you really want to push the boundaries, a mobile phone, right? Perhaps might not have the best experience, but hey, the real value here is that the SDK is agnostic to content, and it's really an open ecosystem just to allow the creators to benefit, but ultimately the entity to benefit. But the real kind of sort of thinking behind this is what happens when this type of content starts being prescribed, right? How do you make sure that intersection between the creator gets the analytics that they need to get, the healthcare entity gets the analytics that they need to get, etc. How do you start serving that purpose? And that's kind of sort of where we're looking, and I'm certainly thinking about a deeper, richer integration, not just that kind of sort of one-to-one relationship between content creation and patient.
So when it comes to and the patient-centered aspect of this, or the patient agency or patient protections, depending on kind of what framework you like to use, who has ultimate ownership or agency over the patient data that's generated through the platform? Is it the creator, or is it the patient, or kind of the healthcare delivery system, or is that kind of up to each product that gets created on it?
I mean, it's a TBD, right? So that doesn't exist right now, Julia. But the thing is, the future of this is how do we mitigate for? So ultimately, the SDK can be carved up in multiple different ways to make sure that different data goes to the right entity, right? So it's not, for that purpose, it's not built yet, right? The vision is, how do we do that piece? How do we solve for scale? But that's kind of some conversations that we're starting to have with some different entities in the healthcare space now is, if it's prescribed, well, how does a patient log into it with a unique identifier that they receive,
Mhm.
which is unique to them, that nobody else knows, but allows them to log in, but then doesn't allow a healthcare company to identify them, for example, but means that the physician knows that ABC123 was Jennifer, right? Or Julia or Dave or Bob or Banu, or do you know what I mean? So that's kind of the real challenge of this when we start to think of it at scale and these sorts of solutions being prescribed. So
Yeah.
that's kind of some stuff that we're starting to kind of like think about, and the conversations what I'm certainly wanting to promote and provoke, so that what we all start to think about this in a far more scalable and patient-centric manner
Right.
ultimately.
And not to fall into I don't know if it's the traps or the missteps that companies like Cerebral have had. I'm not sure if you're familiar, but they've from the very beginning kind of misused their user or patient data for
Oh, the
third-party
guys
marketing.
that, yeah, yeah,
So like they got
I
caught
saw
for that a while back and
exactly.
over prescribing,
Yeah,
not properly assessing, and then just prescribing stimulants and refills and so on. So, and then releasing
yeah,
patient information prior to the clauses of the terms of service that would protect it. So like when you're screening, like what things do you have? And then sell that data
yeah,
because it was before they were actually signed the terms.
yeah.
So yeah. So creating ecosystems that make that sort of thing harder would be fantastic, especially as data becomes more and more sensitive. Yeah.
Exactly right. And we're not even in that sense, in it to harvest the data or whatever else. It just
Mhm.
an intermediary for the visualization for, like, the NHS in the UK, for example, right? How do they, log into the SaaS backend to create that session that means a patient can, put the headset on and, have that therapy session that they need to have, for example, right? Or, what a Mount Sinai hospital prescribes that session to a patient, they get the analytics and the data back for that piece, right? It's kind of, it's very much around those pieces, basically.
So, Jared, did you have any questions? Okay, may just be listening, maybe not. So for the MedXRSI, what would you set as like just hypothetical or for real, what as a priority for this year, like beyond what we're doing already, kind of in this area of this was really in that data management or data ownership. Like
Yeah,
if we could work on a question, an unsolved question.
I think it would be good to almost like pull everyone together and initially get that thoughts on what would that almost like workflow potentially look like at scale, blank canvas, from content creator to patient back to healthcare authority. Kind of what would that flow potentially kind of sort of look like? I think if we could answer that and take everyone's solutions off the table, right, and just think about it from that perspective, what would that kind of utopia start to look like? Because then you can start to think about, right, okay, how would you carve that data out? Where would you put air gaps between things, right, to make sure that certain groups got what they needed to or didn't get, right? That's something that I think the people in this group have the power and the knowledge to, and the insights to be able to say, hey, you know what, a utopian system would look a little bit like this,
Mhm.
right? That I think that's more than achievable to say, hey, this is what it could look like. And then that combined with the standards and the stuff that we're trying to do on that front suddenly becomes, God, these guys actually really, really get it in practice, and they're thinking about it in practice, and they're pulling together all of that expertise of our academia and the research work that's going on, and folks like Jared and his role, etc. Right? It's showing that we're drinking our own champagne, right? Eating our own dog food, whichever kind of expression you prefer. I think that just shows a totally different level of maturity and expertise in this space, right? It's the sort of stuff that, dare I say, the cliched clique of your Accenture, Deloitte, McKinsey, etc., if they could get their heads around this shit, would kind of like start to pull together and say, "Oh, we know what we're talking about. Give us billions to solve this for, you, right?" Like, why shouldn't and why couldn't we do that same said piece? And I think that would be a huge differentiator if we could.
All right, that will be in our minutes. We'll see if we can put together a working group on that, and maybe do a couple sessions all together where schedules do sync up. Right. Thank you, Paul. You said you did have to drop off at the
Yeah, I'm really, really sorry. I've got to jump
so
on a
much.
client meeting. So
We'll talk
really, really
again
great to meet you guys. Thanks very much. Take care.
Thank
Bye.
you, Paul.
All right, wonderful. Okay, so the only other things to kind of cover today, we can go forward. Yeah, so AWE is around the corner in mid-June. XRSI will have a booth at 6:31, but you can, just so you know, we'll be there. I'll be there, Bono will be there, and we'll see who else can make it to cover the table. But we also want to highlight where other XRSI members has speaking roles or roles in kind of directing the programming. So I'll be speaking on the health and wellness track. Our interim CEO, April, will be on the XR policy. Again, on policy, Elizabeth Rothman. Louis Rosenberg will be on stage with Alvin Graylin and Britton Heller on the topic of their latest book, The Next Reality, which, if you haven't read it yet, it is worth the time to listen. It's a lot of the topics we do talk about, just at a more futuristic scale. And then Oscar, which track did Oscar direct, Banu? I forgot. Was it the XR policy?
So Oscar is the track chair for XR enablement session. Yeah.
Okay. All right. And then Skip Rizzo, who's officially a council member still on the list, he'll be presenting his research as well. So over at USC. So we do have a good number of people from XRSI participating in AWE, and that helps with our visibility and letting the greater community know about the work we're doing. And that's, there are standards being developed and there are guides to follow in the development aspect of this. As you may know, AWE it's not medical focused. It's more just the possibilities of the technology at a very broad level, but it becomes a big showcase of the newest tech and whatever the most popular company is at the moment, whether it be like Niantic or Snapdragon or whatever the new thing may be. So we'll be there doing our job. If you guys plan to be there, let us know so we make sure we connect. And so yes, that's June. Oh, we should have put the dates on here. June 18 to 20 in Long Beach, California. All right. Next one. And this is kind of an overview of what we're working to complete this year. We have, so the user safety education and the clinician education, that one, we are figuring out kind of the format and delivery of this. Most of the back-end research has been done. A lot of the synthesis is in progress. And so Ryan, we'll be coming back to you on some of the topics that you wrote comprehensively about, and we'll need to kind of select parts of it to put into the context here. And we're speaking to different journals to see which may be the best match for the condensed version of it, and then kind of a journal paper style perspectives paper, and then having the full resources hosted on xrsi.org. The risks and recommendations, that's been Ryan and Kavia's work. And so once Ryan and Kavia are back working synchronously, we'll finish up that part. Most of the work there has, and Ryan, would you say most of the research work has been done? Is it now about the writing and editing?
Yeah, as far as I know, I think I've contributed everything I could think of. So last I checked, it was in either Kavya or Banu's hands to just polish it up and edit it.
Yeah, I think that's what needs to get done. Okay, we're still waiting to hear back on the ethical and responsible research grant from NSF. That was submitted with both my university and XRSI. And if this gets funded, then we will be reaching out to the different universities and research institutes within the XRSI network. So Jared will be calling you on this topic, because what we'll be looking to do is better understand how human subject research is being done with XR, and educating IRB and different compliance officers on what they need to know, because unless someone tells them, they don't know all the ways that this type of technology can harvest data, and what potential harms are there. So it will be interviewing and observing the researchers, and then developing guidance for compliance offices, IRBs. To that end, I think, do we have it on here? We don't have it on here, but the MedXRSI, myself as the representative, has been invited by Primer, which is the medical IRB education group that is meeting in Seattle. So they've asked us to put together a workshop on this, kind of preemptively of this thing getting hopefully funded. But there is an interest there from the regulatory bodies that oversee the IRBs. So there's definitely hidden need there. And that's kind of our 2024 to 2025 initiative. Janet Johnson is going to run a workshop at the Computer Human Interaction conference. So this CHI, that is right around the corner. So she gets to go to Hawaii and run this workshop on the topic of the frameworks we've developed at XRSI, and kind of disseminating that out to the broader development and research community. And then in August, myself and possibly Divya Chander will go to the New York City Neuromodulation Conference, where we will be talking about the ethics of the use of neurotechnology in combination with immersive technology in both consumer and medical applications. So those are our like actionable things beyond for this year. And if they're, just like I asked to Paul, like, what would be your priority? What additional work can we do? And that, he put something out there. If there are things that are coming to mind for you, that these are things that are timely, that we are qualified to work on, reach out to Bono, myself, Kavya, April, and let's discuss those. And have more of our priorities be coming from our council, which I'd really love to see. All right. That's what we've been up to. So thanks so much for joining today. We'll aim for roughly 4 weeks from now for our next meeting, which I think should work out just fine. And we'll let you know what the agenda is for that about a week or so ahead. But thank you guys so much for coming today.
Great, thank you.
Thank you, Bono.
Thank you, everyone.
Thanks, Jared.